minutes for some opening remarks. Oh, there it is. All right. So the other piece of business is that we're going to be enabling closed captions in case you would benefit from using them. Closed captions, you need to opt into them. And you can do that by clicking on the More menu and then selecting Subtitle from your individual Zoom controls. So I believe there at the bottom, you should see 3 dots with the word More. Once you click on that and you click the Subtitle section, then it should turn on for you. All right, so thank you so much for being here with us tonight for our second ever Compass Housing Alliance Navigates. Navigates is a speaker and conversation series designed to bring our community together, to learn, collaborate, and foster understanding by exploring the complex intersecting issues underlying homelessness and the housing affordability crisis, and to learn about what we can do about it. My name is Liz Gerard. I'm the Director of Advancement for Compass Housing Alliance. I've had the pleasure of serving in the organization for about 7 years. And it's a deep honor to do this work along with the rest of the advancement team. If you joined us in March to hear from Professor Josephine Ensign, welcome back. If it's your first time here with us today, we are really happy you're here. We want to welcome our staff members, board, ambassador council members, supporters, and members of the local community. We hope that you find tonight's presentation and conversation be both informative and also inspirational. I do want to make a quick note about the subject matter tonight. So I think you're probably aware since you're here that we're focusing on mental health. And though we're focusing on mental health, we know that research shows that it is not a core cause of homelessness at the community level. So yes, mental health issues may push an individual into homelessness. But when researchers looked at national trends, they found no statistically significant correlation between high levels of mental health issues in a community and high levels of homelessness. In fact, the only statistically significant correlation that's been found by researchers is between homelessness and lack of housing. So if you want to learn more about why research shows that homelessness is a housing problem, you can view our interview with co-author Greg Colburn via the Vimeo link in the chat, or you can check out his book, Homelessness is a Housing Problem, and that will also be linked in the chat. So tonight, you're going to hear from many voices on the topic, not really much from me, but from a lot of wonderful people that I'm going to introduce you to now. So a bit later, we're going to hear from Erika Spongberg, who is a compassionate and effective mental health provider and who has worked with homeless adults in Seattle for more than 20 years, and especially embedded within our programs. Erika will share information and experiences to help us demystify mental health. We'll also hear from Rex Hohlbein, who will join us to lead a conversation about how we can play a role in our community and help in homelessness. Whether you have yet to take your first step or well beyond learning, leaning into the just say hello, we'll look forward to a dialogue with you about how you can engage. First, we have a real life story to share with you though. This is told by the person who has lived it. We have the pleasure of introducing Mark. Mark is a resident at one of our affordable housing programs, and he will be joined by Teena Ellison. Teena has 30 years of experience in human services, is a coworker of mine, and is our director of housing services. Feel free to add your questions in the chat as we go while folks are talking. At each point, as we hand off different pieces of the program tonight to the different people, we'll have time for questions and engagement. So use the chat as you go. We'll also be using the polling function, which we'll call out a little bit later in the program. So keep an eye out for that. So thank you for being here tonight and for participating in tonight's conversation. And Mark, thank you so much for being here to honor us with your story. So I'm going to kick it over to you.
Great. I'm starting a timer on my clock on my phone so we can stay on track. So first, yeah, Mark, thanks for all the prep work we've done and spending your time with us tonight. Like, you know how we appreciate you so much. So. So one of the things that we talked about is you've recently taken up boxing, right, at a local place. So why don't you tell us why you wanted to do that, and how has living here helped with you being able to get involved with boxing?
basically, I needed the physical aspect of it to also stay in shape, and to now that I have the opportunity to do this, I was able to find a place that accepted me as being from where I'd come from, my lifestyle, my history, and they didn't ask no questions. And boxing was a way that separated itself from other gyms around the area that wouldn't take me unless I had a bank account or insurance and stuff.
Mhm.
And coming from the streets, I just didn't have any of that. And therefore, it's been great, it's been having that opportunity to be able to do other things besides try to survive on the streets.
And the gym that you go to, how far is it from here?
It's basically in the same parking lot almost, right? If I can wake up, go to the gym, come back, go back to the gym at night whenever I'm feeling anxious or I'm starting to worry or think about things. Is staying busy has kept me on point too, kept me grounded.
And your trainer there is important.
Yes, my trainer is also my pastor, and he's also has been on the streets, and he does know the life. So therefore, he does know the things that I go through. So when I start tripping on things, or I do run right over there, and he's right there for major support.
Mhm.
And also, there's a lot of goals up in this spot. It isn't where I can just go there and work out and done. It's an art form, and it's a way of learning. And I'm finding out that there's nothing better than being prepared for all fights at all times. Any way it's got to come.
Right.
So it's good to know. It's just a good thing, good discipline to know. And
Good. So you came to NIRE through some experiences in your life.
Yeah.
So would you share with us for a couple of minutes about sort of, what it was like, what led to your experiencing homelessness, and how you found us here at Compass?
Yep. I'd say this NIRE is the best program I've ever been in.
Mhm.
So I've been in a lot of them. And nope.
What makes it good for you? What's working?
The staff and the openness in there.
Yeah.
Yeah. Because a lot of programs don't have that. So you get kicked out, get right to the streets. They're real short-lived, they're real short time. And this place has really opened up, and staff has been very helpful. There isn't like they take time in finding people. There ain't predators there. They ain't like usually when you get kicked out to the streets from an institution or from some places, there's a waiting list. Well, no one has time to wait. You can't wait. You got no ID. You got no social security card. You got to eat. You just got to get stuff going. And this place has been open, and the staff is always here, and they always have an open ear instead of just a place where the staff ain't so good, and so therefore that's what this place is really sets itself apart, and it's clean too.
Yeah.
So, and I'm gonna say, yeah. So
Well, I think that what I think I'm hearing from you too is that, and with some of your emotion even now, is one of our core values at Compass is love and respect and community. And I think you know that we care about you so very deeply.
yes, ma'am. Yeah, and it shows in just how you guys have how I've even succeeded here. Even my first year, I didn't even have one piece of glass or silverware in here. Normally, you don't make it at any programs, and the programs are short-lived. And like I said, to even get into a program is hard in itself, that most people don't even make it to get in there. And also with no social skills, because you don't learn social skills on the streets. You don't even get to learn about yourself. So it takes a while to even to de-escalate, to even get comfortable until you can open up. And this place, like I said, has really set the bar high on what they do for people.
How is living here and having stability in your living situation helped with some of your mental health and struggles that you've encountered yourself?
Yeah, it's put me in a place of safety, and taking away I'm just still getting to even know myself. Normally I didn't even get to know myself. It was the streets, or they say they're quicksand, and they have their own rules, and you don't get no time to think. It's all, let's just, the police have to show up in riot gear and bulletproof vests and guns to even speak to the people that are living on the streets. And that it's not very safe there. And therefore you don't really get a time to think, to get to know you, or no social skills. It's all about reaction. Otherwise it could cost you your life out there.
Yeah.
So therefore, for me, this has been an opportunity to have a place to go to instead of always looking behind my back it's been a place where I can get away from bad influences that I mean, because obviously it's a group of people out there that and it becomes real. You can get influenced real fast and real easy the wrong way. And so this has set me apart where I can not be around those people, and it's put me in a place where I could have wise counsel to look at and watch from a distance and learn how they conduct themselves and then I can learn from that myself, like I'm doing.
Well, one of the things you shared too, we were just talking earlier about like getting connected to some other resources, but right now outside of boxing, what other things are you doing to take care of you? Like
Mental health. I'm on mental health. I'm in an art group at mental health, solid mental health I go to. I'm also I go to church every day. I mean, I have to keep the narrow path for me. I'm finding out is I have to be, this place has afforded me to be able to stay out of the areas and away from people that I know that will just suck me right back down in the quicksand. And at this point, it's very fragile. Like I have to build it very slowly on everything that I've rebuilt everything from ground up on a solid foundation. And that's having good people with good decisions around me instead of the animals out there, you know. The animals,
well, and I hope you know too that no one's perfect, right? And that you feel safe in knowing that if you do fall, if there is a situation, that we still care about you and you're still welcome here. So we only have about 2 minutes. So tell us in that time, where do you see yourself in the next year or two? What do you see? What do you want for you? I'm gonna turn my alarm off.
Now that I'm in a stable place and a stable environment that I see that is going to last. I want to see myself conducting myself in a manner to where my family and my children and grandkids would want to see me, where they aren't scared of me being a street hoodlum or a street person or they see me doing things that I'm supposed to be doing in society, where I have the opportunity to actually be a productive member of society. That's what I see myself being.
Well, I would like to say I think you're a productive member of society now, right?
Yeah.
And all of us, and no matter what our situations, we're always trying to make our relationships with family and friends better. And so that's just life. And we're just really proud of how you're setting goals for that. So I just want to thank you. I mean,
thank you.
It has been an honor to spend time with you, getting to know you better, preparing for this evening, and I really respect you, and I really respect your willingness to help us get the word out about value of the programming and housing that we provide, because you're exactly why we exist.
Well, thank you for existing.
You know
because
that.
Otherwise it would already be a done thing for me. So this
Yeah.
is the longest I've ever been out here out here. Someone says you guys' program obviously is working even for people on high control like me. So
I know. Well, I'll let you go to the gym and stuff. I'll finish up our thing. So thank you so very much. Can I hug you?
Yeah. Mark, before you go, everyone in the chat is thankful for you sharing your story. Karen says you're an inspiration. Rebecca says that they like your wisdom and insight. I just wanted to share that with you, that everybody's really thankful that you sat down to share your story with us.
Thanks for listening to me.
Don't forget your little, I got him a little card.
Thank you, guys.
Thanks, guys. Thanks, Mark. Have a great night at the gym. I'll be here till about 8:30, so if you come back, I'll check in. Oh, he's got his boxing gloves ready. So thanks, we'll talk to you later. So thank you guys for that. Thanks for listening. He's pretty awesome. So I just need to transition my head. Anybody else need to just breathe and sit in gratitude of, I always feel so humbled and so honored that anybody even bothers to tell me their story or to trust me with it. And that's just a demonstration of what that is. And after 36 years, I'm still baffled that I get to walk in that honor. So that'll transition me to talk to you a little bit about what our Compass model is. So as many of you know, our Compass model is a pretty huge continuum, right? We have our amazing hygiene center and where people can come and shower and get their laundry done and go upstairs and get a meal, and get help with navigators who will talk with folks to help them get housing or other resources, IDs, things like that at our day center. And then, of course, our multiple shelters that we have downtown and the Blaine Center, and then our women's shelter, the Jan and Peters Place. So our shelters provide an essential service for people who are waiting to get into some housing. Or maybe sometimes it's just situational and they just need a minute to get on their feet and then they can kind of get back out there. But what I'm here to kind of like highlight a little bit around our mental health component is in our permanent supportive housing models. Our model is what we call housing first or harm reduction, low barrier housing. What that basically means is just that people who apply for apartments face tons of barriers, right? They have evictions, they don't have a good credit rating, they might have a criminal record, they might, they might look a certain way and a property manager just doesn't want to rent to them. So if there's property managers on here, I apologize because it probably wouldn't be true for you, but it's true that it happens. So we don't do that. Right? We earlier today, we met with some people from SPD, they're community service officers who are not police officers, they're social workers, and met with them here. And they love the fact that they're like, so you'll just take people as they are. We're like, yeah, that's who we want, right? So our housing model is we house you first, and then we help you and support you at looking at what are your goals, what have some of your barriers been, what are some of your challenges, what do you want to work on, or what are your strengths, right? Like we're such a deficit society, but let's admit the fact that there's a ton of people like Mark who have amazing strengths. So how do we help them identify their strengths and then say, he survived on the streets and in other institutions. What strengths did he draw on to survive those and navigate that he can transition and use those strengths still and lead a different life, right? So we want to have a strengths-based perspective with people as well. We are a housing provider of multiple chances, not second chances. So otherwise we'd just be rotating people, right? And so we choose to house people who might not otherwise be able to be stably housed elsewhere. Like Mark shared, he's been here almost 3 years. It's the longest he's ever lived someplace, like outside of prison, right? This is the longest place he's ever lived. And he's doing the work. He also doesn't have to work hard. People don't have to set goals, right? They can just live, and that's okay too. We want to encourage that though. We want to encourage people to keep moving on. Harm reduction is basically what that means is we don't require people to be clean and sober to live in our housing. We don't require them to expunge criminal records or any of that. What we want to do is help them live as healthy of a lifestyle as possible, but we often refer to as quality of life. So how, whether that's, using clean needles, or how can you drink less so that you don't fall down the stairs, or, what do you need to do how do we get you a primary care physician so you're not going to the ER all the time? What are those pieces that we can do to help improve your quality of life? It's not our job to judge what that quality looks like, but we want to help people understand that they're loved because they're human. And at Compass, our value is we love you. If we got to not love somebody because we screwed up, I'm pretty sure, I won't speak for anyone else, but I would be unloved because I've screwed up, right? And I have a lot of skills and tools, and I screw up. I screw up parenting, I screw up as a wife, I screw up as a friend, and grace and forgiveness are critical when you love people. And that's what we get to do here at Compass. We also to get into housing, we have, there's multiple ways, and people have questions about that they can ask later. Our homeless housing, like here at in our permanent supportive housing properties, are through coordinated entry for all. There's some gaps that we don't meet because people have to meet eligibility. Eligibility is my 4-letter word, because if you're human, you should be eligible. So, that's how that goes. So that's kind of my brief summary. There's a billion things I left out, but that's the overarching umbrella. And with that, I'm going to turn it over to Kate, who is one of the staff in housing at one of our housing properties called Nair Ernest House. And she's also an ambassador council member for Compass Housing. So Kate, back to you.
Thank you,
And thanks
Teena.
again, everybody.
So we're going to open it up for Q&As in a moment. I think Nathan has a quick poll to send out. And just to clarify, we're going to focus on questions about Compass's model. Clearly, Mark has stepped out, so he's not going to be able to answer any questions about his story. But even that brief amount of time was very impactful for me, at the very least. I'm sure for a lot of other people too. So if we want to get that survey, and we'll just take a quick minute to fill that out before Q&As.
While you're doing that, Kate, I can say that it was pretty intentional not to have Mark here doing the Q&A. I didn't want to put him in any position that might make him uncomfortable. It took a lot of courage for him to just do this piece. And so I'm sure he might have been willing, but just to be sensitive to that, it was just more of for me, an ethical decision to not even ask him to be participating in that. So I just want to own that responsibility.
Yeah, thank you for saying that and for clarifying that, because I think that's really important. All right, Nathan says we're almost at 100% on the poll. If anybody else is thinking really, really hard about those questions, that one question. So it looks like the vast majority of people think that being housed affects a person's mental health a lot. I read a significant amount, and for me, when I think a significant amount, I'm like, oh wow, that's a significant amount. And I was like, wait a second, let me choose the ones that's the most. Teena, do you want to speak to that a little bit while people kind of get their brains rolling into questions they might want to ask if they have any?
Right, yeah, for sure. I think that how it impacts someone's mental health has a lot to do with the person and how much they want to engage, right? But without a doubt, and it might not be measurable for people, but for people who have lived homeless or with lots of historical trauma, being around housing instability even, or extreme poverty, being housed, sorry, there's a fly flying around my head. Being housed and having that stability that's not tied to income and things like that is very much so reduces a lot of just even the neurological impacts are huge. You can breathe better. However, that a lot of people have been housed and lose their housing because they know their behaviors and things. It takes a long time for people to trust that when they mess up, they're not going to get evicted. So there's still a fear. We get people who don't report damage in their apartment because they're sure if they report it, they're going to get evicted. It takes a lot of time to earn their trust. So even if they don't get any clinical help, we know that just, it's kind of like Maslow's, hierarchy of need. They get that foundation piece. And once they really feel like they're sitting in some stability, then they start getting to experience other emotions and other experiences. And then they can like dive in. But there is not a prescription. It's not like, well, if you live here for 3 months, after that, things will get better. Every person's story and journey is different. Our job is to walk along them. Sorry, Kate.
I was going to bring up the hierarchy of needs myself as you were talking. I was thinking about that. We're all environmental creatures, and we need that stability. Pam asks, does Compass have more housing being built in the future? And if so, how much?
So yes, not anytime in the next like 24 months, probably. It takes a long time to build. Thank you for that question. If anyone wants to write a big check, we could get started sooner. But it takes a lot to do the low-income housing tax credit applications and things like that. There's the lovely bureaucracy of things, but Compass's goal is to continue to build more housing to meet the needs of the community and to meet the variety of needs, right? So we have permanent supportive housing for chronically homeless people who've lived chronically homeless with a disability. And then we have tax credit low-income units for kind of what we would consider like the working poor. So there's a set rent amount, you do have a rent, but we're still a fair housing market and we still are doing the harm reduction model. So there's still people who are getting supportive services and things like that. And they don't have to have been living chronically homeless.
And if I can add, actually, we're about to release our strategic plan. In fact, we have the printed copies ready to mail. And in the strategic plan, once we release it, you'll get an email or you may even receive it in the mail at home. We've identified a goal to have our next development project selected by 2025 at the latest. And the rest of our strategic plan really points us to that goal. So we're setting up the dominoes to fall, if you will, for us to grow and share our great services. So, yeah.
Thanks for asking that.
Got another question. How do we help educate other organizations to understand the importance of love and respect so that as a larger team, we can grow this philosophy?
Well, good news, sort of, is in the near future, like very near future, like months, we have a really strong model here at Compass, and it existed well before me or other people, but we've sort of packaged it now. And so we are going to be looking at other landlords, especially in the affordable marketplace, and sharing with them how to provide supportive housing like we do at Compass. So that's one thing we're going to start looking at doing. The other part is, which is a big part of my job, is I meet weekly with multiple other providers in other housing, and we talk about philosophy. I have shared our manual that we have. We have a services manual that talks about how we enforce lease enforcement in a compassionate way. We have a progressive discipline model. I'm distracted by that gorgeous puppy. No, don't take the dog away. Don't take the dog away. Bring it back. It's a good focal point. So we are working really hard in community. Thank you. We're working really hard in community to help, for lack of a better word, manifest and foster that same model with other non-traditional service provider housing folks. So does that help answer that question?
I'm going to guess yes until I see another chat message pop up. Okay, we've got another question from Pam. I see on social media that people believe Seattle's homeless population is made up of so many people that came here because they heard about all of the quote unquote free help they get in the city. What do you say to those?
Yeah, I think that's an excuse just to hate on the homeless, but what is partly that. Because I mean, you know, I don't live in the city of Seattle, and there's homeless populations everywhere. And outside of Washington, if you travel, it's everywhere. So I think in the winter time, sometimes we might see a higher population because, or in the summertime, Florida might see, and California might see a higher population in the summer, you know, or winter times when it's cold in other regions. We don't have free help, right? I mean, nothing's free. Other places might not have as much as us, right, in terms of services. That might be something I would encourage somebody, if they felt it was negative, I would try and reframe that for them about how does it feel to live in a compassionate community, right? Like, how does it feel to live in a community where we see each other as humans and we see each other as valuable? And so how does it feel to you to know that some of your tax dollars or some of your donation dollars are going to help some of the folks who can't help themselves? Like, you met Mark, but I also could have introduced you to, and Mark has lots of skills and abilities, but I easily also could have introduced you to somebody else who, you know, is 80 years old in a wheelchair, who's lived homeless for 30 years, who's not going to get a job, who can live on Social Security. We have veterans, we have veteran units, we have veteran buildings, we have veterans in all set-asides in all of our buildings. So we have veterans who have lived homeless, who are helping. And so I would just say to somebody like, I guess I'm proud to live in a community that cares for people just for being human. I'd rather live there than somewhere else.
That's such a clever way of, I just have to say, of flipping it, because when I hear that, my first response is like, I need to debunk that because that makes me mad.
Yeah.
And kind of flipping it on its head like that, I don't know. It's a nice little brain hack.
Well, they just get defensive, right? Because Kate, I want to respond the same way you do. I want to just kind of do some education. But then people get defensive. And so I think, it's using our skill sets sometimes in those situations to reframe and invite someone to think about something different.
Okay, a lot of chats coming in at once. I'm trying to skim for questions. Somebody said that they believe gentrification, high rents, and mortgages has forced many people out of their homes and into the street.
Well, and we should talk a little bit about how we do have chronic homelessness, right? People who've lived chronically homeless for 12 months or 20 years, for long periods of time, who often do have some untreated mental health and substance use illnesses. We also have folks who don't have some of those experiences, who have situational homelessness. And that's where the big gap is, right? So that's where the big gap is somebody who loses their job, doesn't have family, doesn't have family who has financial ability to support them. And they find themselves within a few months of a tragedy living in their car with their kids. And because they don't meet chronically homeless status, they're sort of in this, can be in a dark place where they're not eligible. And so, so that's where there's a bit of a dark hole. So not everybody has the same experience. Everyone's journey is their own unique one, and we need to look at all of them through that really compassionate lens. And I don't think anybody here would want to try and make someone who's having a situational homeless experience, make them chronic in order to provide them the supports that they need to get back on their feet, right? So that's one of the things Compass is really committed to as well. And my time is up, but I just want to say thank you to everybody for investing your time in this.
Do you want to take one more question?
Sure.
Because one just popped up and I don't want to
Mhm.
What can I tell people who rant on the drug addicted, doing drugs everywhere to quote unquote reframe their focus, similar to your earlier suggestion?
The first thing that popped into my head was, well, if you didn't have a house, where would you do your drugs, right? That might not be. Well, I tell people too, like, do you know what your neighbors are doing behind closed doors? Because I don't, right? So, well, and I have said this to people. If you were homeless for 12 months or more, or if you were homeless for a long period of time and all the situations and traumas that hit you, drugs probably make some sense, right? Or drinking, like your reality is not very lovely. And so, and also I've met like literally at least 1,000 homeless people who've lived homeless in my career, probably more than that. Not everyone's a drug addict and not everyone does drugs. And not everybody who does drugs is a drug addict. And so I would just really reframe and say, why do you think people who are living on the street, why do you think they might turn to drugs? Because we don't know, did drugs come first and then homelessness, or did homelessness come first and then drugs? And sometimes it's both of those are true. But I would just ask, why do you think people who you see on the street doing drugs, why do you think they're doing them? Because I've never met a drug addict once. And there's some people who are in this industry in here who got high and planned to become an addict. I've never met anyone who had a glass of wine or a beer who planned to become an alcoholic, right? You don't know you are until you cross the threshold. And so I think that that's also really important. And everybody on this planet knows somebody who has an addiction, whether it's food or sex or substance use. So I would like us to encourage reframing judgment until you remember someone you love has walked through a really hot fire.
Thank you so much, Teena, for your thoughtful commentary and answers. I feel like I learned a lot also, and I really, really like your tips on changing that defensive habit into let's invite the other person to think in a more compassionate way.
Yeah, yes, it's intentional.
As a new member of our team, Sam would say, preach, because I really appreciate what you both had to say. And Kate, thank you so much for joining us as an ambassador council member and as a person who makes these critical programs work. I was at the program on Monday and saw Kate working the front desk and dealing with the milieu and on the phone. And, there's a lot of work that goes behind what we do every day. So I appreciate you.
Always juggling,
Christina.
always juggling.
Yeah, there's definitely a hustle. So I want to make a transition now. We're going to hear from Erika, who I told you about earlier, who is an embedded mental health professional in our programs and has a ton to share with us from her perspective. So Erika, I will leave it to you. Oh, take yourself off mute. Yep. Okay.
Here we go. Sorry about that. Hello, everybody. Thank you for joining us tonight. And just a little bit of history. I had the pleasure of working at Jan and Peter's Place, which is a Compass site. Great people there, and now working at the Day Center as a mental health practitioner. And I like the topic tonight. I didn't choose the name, but I think it's a great name, Demystifying Mental Health, because I think it gets to the heart of the matter, which is that there's a lot that we know about mental health, a lot that we've learned in the past few decades, but there's also a lot that we don't know. Don't know what causes it all the time. We give medications that we know work, but we don't know why they work. Spoiler alert, we're not going to demystify all of mental health tonight, but my hope is that we'll give you some more information and some thoughtful challenges about thinking about the topic further. So Nathan, can you go to the next slide? Thank you. I'm going to set my timer here because I don't want to run over. So this is basically what we're going to talk about tonight. which is understanding mental health and mental illness, because very often when we mean mental illness, we say mental health. So separating those two and realizing they're two different things, talking about the system that we use to treat mental health, and then finally kind of thinking about what's the relationship between homelessness and mental health. There's been some statements in social media, I'm sure that you've seen it, linking all homeless with mental health. That's not true. But what is the relationship, and how does that change, or how does that inform how we approach homelessness and how we approach treating mental health? Nathan, can you go to the next slide? Let's start with our first question. What comes to mind when you think about mental health? And I'm going to add one more question. What comes to mind when you think about mental illness? There's a lot of different views about this, and no agreed upon definition. So there's no right or wrong, even among specialists. So I'm going to ask you to take a minute, answer in the chat or raise your hand. Liz will respond to raised hands. And what are your thoughts? What do you think about when you hear mental health or you hear mental illness? What comes to mind? Okay, so trauma with mental illness and safety with mental health. That's a great point. Quality of life for both. Okay. Any other thoughts? I missed some of them. I apologize. What should I do to help that person, or should I stay away? We're going to get to that. So that's a good question, and that's one of the things that we're going to address tonight. I saw something from Shri, and I didn't get to read it in time. Category of mental health sets apart and isolates. Yes, it does. Isolation.
Cherie was just saying that the majority of people who overdosed are people who are housed, not unhoused.
Ah, okay. Mental health, depression, comments. Okay. Oh, hold on. You know what? There we go. My chat line disappeared, so I just got it back up. People, please appreciate your patience with my Zoom skills. Let's see. Term illness is old school. Category of mental health sets apart and isolates. Mental health is very isolating. Mental illness is very isolating. Depression, large issues that need more than therapy. Good point. Stigma attached to mental health, that's definitely something that prevents a lot of people from even seeking help because of the shame and the guilt. So yes. You forgot the question. What comes to mind when you think about mental health or mental illness? We all have mental health, some is positive and some we struggle with. Yes. Yeah, so good questions, good insights, and good points about the impact it has on people's lives. Chemical imbalances in some cases, yeah. These are really good comments. I really appreciate your feedback on that. Well, let's go to a picture that might give us more of a visual in terms of how to think about mental health. There's even among specialists, and you've seen it in your responses to what is mental health and what is mental illness, different ways of thinking about this. Some people get very reductive about it. Mental health just means not being mentally ill. That's generally not accepted anymore. Some link mental health to being positive, being productive, functioning well. Can anybody see any problem with that? Linking mental health to productivity and being positive? Oops, let me turn my chat on back. Sorry. Unrealistic expectations, right? Productivity feels very capitalist. Yes, there's been claims that that's a very Western or North American approach to mental health. Other claims have been made that there are situations where you should not be happy. If you are living in a war zone, if you were living in, Nazi Germany or Khmer Cambodia with what's going on around you, positivity would actually probably not be a sign of mental health, right?
I do see
Uh,
one hand up from,
Oh.
I think Paul and Boots.
Okay.
Oh, I just saw you put it down.
I just put it down. I think somebody else already said it. That all of us have times, and to say mental health is when you're positive or productive. I don't think anybody here could qualify. I certainly couldn't qualify as mentally healthy because it's part of life that you have all those ups and downs, and there are times when we're not productive, and certainly we're not always positive. I think I would question anybody who said they are.
Yeah, I mean, it's a very common definition. Who has not defined mental health on an international scale in similar terms? But there certainly has been questioning about, do we always have to be positive? Are there not times when it's appropriate to not be positive? And I think the answer for most of us would be yes. And productivity is as a function of mental health. Does that mean that all disabled people are inherently mentally ill because they're not productive? And I think the answer to that would be no, obviously. So with that said, we're going to work with the following definition. For the time being, understanding that nothing's engraved in stone, but just for our purpose today, let's understand mental health as the mental processes and behaviors that provide someone with the ability to cope with the daily demands of life effectively. And have a generally constructive relationship with their own self, with others, and with their environment. Is that a definition that folks could sit with? Yeah, I see thumbs up. Thank you, Kate. I'm looking to watch that. Okay, well, you can comment and see what you think about that definition. I should have made a slide that might have made it easier for you, but be that as it may.
There's lots of thumbs up if I'm scrolling through people's feed. I know you can't do that because you're presenting, but we're getting good thumbs up.
Good, thank you. Thank you. So just want to go over some really quick factors that might affect mental health when we're thinking about defining it. First of all, what do we mean by mental health when we're talking about mental health, mental illness? You're talking about a lot of different components. It is not one thing. It is your mood. It is your thought processes. It is your memory. It is your judgment, insight and self-awareness, social skills, executive functioning, your ability to pay attention, stress management, how you manage stress, and even your personality. There's a whole category of diagnostic codes called personality disorders, which often develop in response to something from your environment and impair your ability to function effectively on a day-to-day basis. Other factors that can influence our understanding: gender, race, culture, religious beliefs, ethnicity. And I thought about this at the end, even language. I remember watching a TV show once and they had, it was a fictional comedy kind of thing, but they had a woman from Africa saying that in her tribe, there was no language for the word lonely. So if you have no language for the word lonely, how do you tell somebody about being depressed? Because that's often one of the symptoms. And you can think about that with a lot of our clients who, may have traumatic brain injuries, may have trauma, may have a limited education. They may not have the words to tell us what's going on with them. They know the experience, but they can't name it. So language can also limit how we understand mental health. And I just want to, Nathan, can you go back to the puzzle slide, the previous slide? Is that possible? Oh, there we go. Thank you. So I really like this visual because it took us out of sort of a pathological sense of mental health, which very often kind of dominates our culture when we think about mental health and mental illness, and puts it more in terms of a puzzle. And that, you know, if we're doing really well that day, all the pieces kind of fit together nicely, and we kind of chug along and go through our day. And mental illness is when something comes in and kind of disrupts how those pieces fit together. It could be temporary, it could be permanent, it could be severe. Mental illness exists on a spectrum. We could be depressed for a few days. We could be depressed to the point where we need to be hospitalized. So it's not a simple black and white discrete episode, as much as it is a spectrum of behaviors, thoughts, and feelings, and how they integrate internally and help us integrate with the world around us. Okay, can you go to the next slide then, please? Any questions so far? By the way, if anybody has questions, please jump in. Liz, I can't see the chat and my slides at the same time.
I got you.
Okay, thank you. So now that we've gotten a rough definition of mental health and mental illness, what do we do? How do we treat mental health and mental illness? And basically, it's one of two options, outpatient or inpatient. Most people get treatment outpatient. Community mental health agencies, medical practices, hospitals, and then the inpatient. Can you bring up the first picture? Thank you. So this is what we think of with inpatient. This is a great picture. This is Western State Hospital when it was first built. Western State Hospital Washington has two state psychiatric hospitals, Western and Eastern. This is Western. It was built before Washington became a state. It used to be a military fort. They're still using the same buildings. So to be aware of that. And it, let's see, it was named Western State in 1889, just when Washington became a state. It has 800 beds. It's one of the largest psychiatric hospitals west of the Mississippi, and it employs over 2,500 people. So it's pretty huge. And actually, can you jump to the second picture now, Nathan? There we go. Thank you. So on the left is Western State when it was first built. On the right is Western State as it exists today. And it is pretty big, as you can see, many buildings. We'll get into the pattern of what's going on with inpatient hospital care in a little bit. But this is because law enforcement is, we'll get into this a little bit later, but because law enforcement is used so often to deal with mental health crises, not surprisingly, a lot of people get arrested and they have a forensic unit at Western State. Western State lost its federal certification in 2018 for a number of reasons and has not gotten them back since then, which just means it's not Medicare reimbursed. But this would be the inpatient, involuntary inpatient treatment path if you were to go that route. So can we go on? What's the next slide? I'm just juggling paper here, Nathan. I'm sorry. No, let's go back.
We do have one question from Pam who asked,
Oh, sure.
You know, how is it even possible to have people living, you know, in a place in Washington State that has such bad, you know, I guess,
Mhm.
operations that it lost funding. Like what?
Right.
How is this possible that Washington is ranked among the bottom, I think, 3 states in the nation for our mental health care system?
Yes, it has the highest and one of the highest incidences of people with mental health issues, and one of the lowest rates of psychiatric services in the country. And that has historically always been the case. I first came to Washington 20 years ago, and it was the case back then, and it has not fundamentally changed. There are different patterns emerging now, and we'll get to that on another slide. They lost, I don't know the exact reasons, the precise reasons for why they lost certification. It's not simply, it's not as simple as just patient care. It's also staff care. There's a lot of injuries in Western State with staff. And then just a lack of funding, which is another thing that plagues the mental health system, just like housing. But hopefully we'll get to a little bit more of your answer when we get around to sort of the history of mental health care.
Yeah,
So,
and in fact, Erica, we have about 5 more minutes left.
oh, sorry.
So no, totally fine. We haven't done this before together either.
Okay.
So, however you want to prioritize your time
Yeah.
in the direction we're headed, we're happy to hear more. And like you said at the beginning, this is not going to be the last time we cover this. This is a scratch of the surface for sure.
Yep. That's not so. Just to summarize this slide, basically, if you're looking for mental health care, how do you get it? And the options are either outpatient or inpatient. And outpatient, we'll get to how you access that. But mostly if you have insurance, you call your insurance company and find out who they cover. If it's Medicaid or Medicare, they can help you find. You go to your primary care provider, you ask them. There's lots of options that way. And then inpatient, you can go voluntary or involuntary. Voluntary, you're depressed, you're suicidal, you feel like you are doing the best you can, but you really need a break and go somewhere. And you can check yourself in. Very hard to get a bed because of the shortage of beds in Washington, but it is possible. And then we're going to go to, can we go to the next slide? Because this is the one that we often see with our clients. You see a mental health crisis on the street. You're not really sure what to do, or you see a person having a mental health crisis on the street. You're not really sure what to do. Do you get involved? Do you not get involved? And basically, there's 2 questions that you need to ask. Is the situation life-threatening to the person involved, or is there a risk that someone may get hurt? And in those situations, you call 911. If there's no immediate physical danger, then you call a place called Crisis Connections. They run the crisis clinic. They have access to a number of resources, and you can tell them that this person is in trouble and they need some help, and they can help connect you with whatever that help is. If you do end up calling 911, some things that I really would like to stress, they're going to ask you where you're at. Very often I know my way around, but I don't know the exact address. So you want to know where you're at so that you can give them that. They're going to ask you if the person has a gun. And I can't emphasize enough, or if the person has an arms, please do not guess at that. As you know, there's been a lot of crises that have ended unnecessarily in death. So remember that I don't know is always an option when you're asked that question. And to not guess. And then they're going to ask you what behaviors you're seeing. And again, to describe the behaviors without guessing what's causing them, because honestly, you don't really know. So those would be your 2 options for responding. Nathan, can you go to the next slide?
About how long is the wait for voluntary inpatient?
Voluntary
typically?
inpatient depends on the bed. Voluntary is hard to get only because you'll need approval from your insurance usually, and then you have to call around to each hospital to find out if they have an open bed. And that's where the difficulty comes in. There are times I've lucked out and I've gotten somebody into a bed right away. There have been times when there have been no beds and I can't hospitalize you. So it really just depends on the bed situation. During COVID, I would tell you that it was probably impossible to get a voluntary bed, just given what was going on. So I have a couple more minutes, Liz,
Yeah,
am I?
like
Okay.
two, if you
Okay.
can, yeah.
So what happens after you call 911? A lot of questions I get is, Eric, I saw this person on the street and I called and they didn't do anything. Why wasn't this person hospitalized? And there's a really simple reason for that. Washington is an outlier with most states in that they are very strict about hospitalizing somebody. When you hospitalize, you involuntarily detain somebody, you're suspending their civil rights. And Washington is very strongly about supporting civil rights for a person. So the only people who can hospitalize somebody are called DCRs, designated crisis responders. They can only hospitalize them for imminent risk of harm to self or others or property, major property damage, or gravely disabled, that they're unable to take care of themselves to the point where it's life-threatening. And there has to be evidence that these reasons are directly linked to mental health, not to some other reason. If they don't meet those, then the DCRs will not detain. DCR's ability to detain supersedes that of doctors. So that really is the key. If you see somebody who's really hurting and they haven't been hospitalized, it's because it's been determined that they don't meet those needs. Doesn't mean that they don't need help, but they don't meet the needs for detainment. DCA is a month out at the moment. Yes, at least a month out. Their workload was 50 or 60 open cases at any given time. Their workload now is, they said, between 100 to 120 cases. So, I've called DCRs and I've had them tell me that it's going to be weeks till they can get somebody. They prefer to see the people in hospitals because it's central and they can see a lot of people. So there's any way that you can safely get that person to the hospital. But if they are really in crisis, that's where the police would be most helpful. You don't want to transport somebody yourself because you just have no idea what's going to go on in the car if they're in crisis. Sorry, we're just running through this. I knew it was too long, but trying to cram everything in there and not quite getting it in. Any questions? We'll just cut it at that point. Oh, one last thing. I just would like to tell a story because it links into what Teena was saying earlier. In terms of housing and homelessness, we know that they're interrelated. They're not causal. We know that homelessness does not cause mental illness does not cause homelessness, but there is definitely a relation. More people who have mental illness are homeless than the general population. So that being said, lovely story after our interview with a client who was homeless. He was, they tried to house him 3 or 4 times. This is going back a few years, and he couldn't make the appointments. He just was so mentally ill that he couldn't even show up for the appointments, which is very often the case given our very difficult system. And I think, Teena, you're familiar with all the hoops that they have to jump through. Finally, we get him in to housing, but he's adamant that he does not have a mental health issue. So he won't see anybody, he won't talk to anybody. He eventually gets caught up with law enforcement. He goes to jail. Now he's got charges pending and he gets ITA. He gets involuntarily detained because of his mental illness. Long story short, after 3 years of not engaging with anybody, being totally off everybody's radar, he gets outreach. He eventually, after a year or 2, agrees to take medications, and they agree to drop the charges based on his increasing stability. So that puts the legal thing away. And then after a year or 2, he finally agrees to see a psychiatrist, and the psychiatrist gets him on a better combination of meds. And then finally, after a year of that, he agrees to enroll with a community mental health agency, which was unheard of 4 or 5 years ago. And basically what housing allowed him to do was regular contact with outreach people. You can't do that on the street. It doesn't matter how many outreach teams you have, you just can't. So his ability to stay in one place, have people come to him, and be able to find him was critical. And then building up a relationship over, 3, 4, 5 years, that's how long it can take. To the point now where he's been stably housed, he's staying put, doesn't have legal involvement. And, he just got involved with permanent mental health care, which is huge. So
Yeah,
sorry, I
it's like
ran
he
a
won
little
the
off track.
lottery, right?
It-
I mean, in terms of the way these things can go.
It totally is. When the doctor told me that, my mouth just dropped because, 5 years ago, he wouldn't talk to any of us. So that was huge. So housing makes all the difference in the world.
Thank you. We have actually a couple people in the chat. I noticed Megan and Cherie chime in. They work at our housing programs up in Shoreline Veterans Center and in Renton Veterans Center, respectively, talking about the DCR wait time. So, these are frontline staff on the ground telling you their experience with navigating a system that is not friendly to people in need. So, Erika, thank you so much for sharing your experience with us. I hope to continue the conversation. You do incredible work, and I know there's more to learn from you. So thank you so much for your time tonight.
Thank you. I appreciate it. Sorry it was so rushed, but
No worries.
I appreciate it.
We're gonna move over to Rex, who has a kind of a complimentary message. And Rex, I would love you to introduce yourself to the group.
Hello, everyone. So I'm Rex Hohlbein. I've lived my whole life here in Seattle. I don't have any credentials that would qualify me to talk to all of you about mental health. And I think let me just get back to the gallery view. For some reason, it changed. I like seeing all your faces. But what happened to me when I was about 50, after running my own architectural practice for 25 years, I just, dumb luck, met a number of people that were living homeless. And it's cliche to say, but it changed my life. And when I hear Teena and the rest of you talking so beautifully and compassionately about it, it just makes me want to tear up, because that's the life-altering event that happened to me. And the reason I bring this up is because one of the things that I firmly believe, even having started a nonprofit, Facing Homelessness, I don't think we're going to end homelessness if we only look to nonprofits and religion and government for the solution. And the glaring omission when we talk about homelessness is the community. And when we talk about brainstorming solutions for addressing homelessness and all of the components of it, such as mental health, we are pushing a rope, right? We are having these nonprofits and government and religion all doing heavy lifting, and they're never going to get there. And it should be obvious to us as a community. And I think we should spend a lot more time trying to understand, why are we allowing homelessness to take place? And so I'm gonna try to not go over, and I'm gonna break this quick little talk into 3 components. One is just kind of further clarifying the definition of homelessness, the homelessness crisis. The next would be our relationship with it, and then what is that process that we can go into? And this is super truncated, so I apologize. But I would begin by saying that we're doing ourselves a disservice by focusing on it as a homelessness crisis. And we should begin to rather view it as a community crisis. And the reason that that's the truth, in my opinion, is that when we talk about homelessness crisis, we talk about those people over there. We put them in an arena, and we spend all of our time othering them, and also spending all this kind of intellectual energy on trying to understand how to fix the problem. What do they need? They need more of this. Oh, we should change this. We need to raise more money for them there. But it all stays in the head. And when we say community crisis, and that's externalized, right? It's like a problem over there. When we say community crisis, we internalize it. we instantly include ourselves because we all know that we are members of the community. And so we need to say, this is not their problem, this is our problem, this is my problem. And in that moment, we internalize it, and we begin to view it emotionally. And at least for me, but I think most people are like this. We move not when we see numbers of statistics, but when we are touched by it emotionally, in a human way. So I think in that moment, in that aha moment of that we are involved, another little aha comes, and that is, wow, that means I'm going to have to make some changes personally. I'm going to have to figure out, what can I do? How can I change? If I'm a community member, how can I change to be a part of the solution? And, one could argue this is why ending homelessness is so difficult, because it has more to do with changing ourselves than changing the homeless. And we know how hard it is to change ourselves, right? But I believe this is the correct definition of the homelessness crisis, is to include ourselves and to get to work on ourselves. Like we have work to do. And I really appreciate when Mark said, being at Compass, he was getting a chance to know himself. Well, homed people don't know themselves any more than homeless people do, right? People that are homeless. We're all on a journey of trying to figure out who we are and how to live better, more compassionate human lives. And that's actually a gift that that people that are homeless give to us, to to listen to Mark talk, to listen to anybody talk that's homeless, reminds us what's important. I love the Mariners, or the weather, but these are not the things that we need to make important in the grand scheme of things. So I believe that if we view it as a community problem, then we draw a line in the sand. And from that moment moving forward, we have to look at our own life, and we have to ask, what am I going to do? Now, I don't think it has to be, well, here's another way to say it. Up until 50, when I was working as an architect, homelessness was overwhelming for me. I didn't come up through the social service education. I didn't study anything that would prepare me to meet people outside. And so I was overwhelmed by the issue. And I have to remember that that's the general public. The general public is intellectually overwhelmed by the topic on homelessness. And yes, they can venture in and start to get, by coming to things like this forum here and others, to get more educated. I'm going to cynically say, and I'm not a cynic, I'm not pessimistic, but I will say that we can feel when we get intellectually smart that we're actually doing something, but we're not. We're not doing something until we put that into action. We get to look better at the dinner table with conversation, but ultimately we have to convert that knowledge to action, and we have to move forward with something that will make a difference for those that are actually struggling and suffering. So that's what meeting someone, that's why coming closer and getting to know somebody and hearing their story and feeling their story actually creates that profound change. And I believe ultimately this is the answer to ending homelessness, is that we all have to come closer. We have to listen to Mark's story. We have to, Teena, I know when you're responding, about that, or Liz, and any of you that are sharing these messages, you know deeply like how it's affected you and how it's changed your life, right? So the trick is, how do we get the public to do that? Because that's the game changer. And also, I want to quickly say, that's not taking anything away from the profound work that Compass is doing, or any of the other nonprofits in the city. They're so vital. It's just they need the community's help, and they don't need it just in funding. They need it in brain power and heart power. They need it in, you think about our population in Seattle, and you think about all of the skills and all of the unbelievable ideas and the smarts and everything. Imagine if that was brought to the process of dealing with mental health and other issues around homelessness. we would be awash in solutions, right? And yet what we've done is we've given the task of solving homelessness to a relatively small percentage of us humans. That's not going to get us there. We need everybody. So I would say, so that's redefining it. It's a community issue. Number two, it's a personal journey, right? Like it's a call to arms. I think I've never looked at my life closer than I have when I listen to people like Mark. It makes me just think about like, what am I doing in my life? And so then that gets me to, if you created that moment, I was lucky. I met a couple people that just altered my course of my life. Beautiful, genius, amazing people. People say, well, you can't just go to the grocery store and order those moments, right? Like they don't just happen. So the answer for me on that is that you prepare for those moments. You are ready when they show up, and that you do that by listening to Compass Navigates. You read the Real Change newspaper. You do the things that get you ready, so when that moment happens, it doesn't just pass you by, that you can actually latch onto it. And if that happens, if you're ready to move forward in a heartfelt way, I think then you have to earnestly decide how you're going to do that. And that is this last part that I was going to talk about, which is, and please interrupt me, even though I feel like I'm rushing to not get beat by the clock. Let's just be clear, it's tricky. You're not wading into a journey that says, oh, now that I'm doing this, everything's going to be beautiful and turn up roses. And you have to go in knowing that it's messy, and in the messiness is the beauty and the humanity. Oops, I'm getting a phone call, sorry. And be comfortable with being uncomfortable, and leave your expectations at home. I was talking to Anne earlier about this, about, you've got a moment of compassion. You see a person outside of Starbucks, you come out with a coffee for them, and they tell you that they wish that you had gotten a tea instead for them. And you're irritated, like this ungrateful person. And yet in that moment, because you engaged, you go to your car, you drive away, or you walk away, and you reflect on what happened. And then you begin to reflect on, why am I offended by that? That person is struggling and suffering. And I literally had a pillow last night that I absolutely felt good about, and a warm shower this morning. And I think we can't get there unless we engage, and we can't get there if we don't challenge ourselves to be there. My advice would be to give yourself a lot of latitude. Somebody earlier said, it's okay to fail. It's okay to mess it up. I hear a lot of people say, well, what would I say to someone that's homeless? You would say what you would say to any human being, right? And sometimes you don't have to say anything at all. Maybe you just are there for them. But in a process way, I would say you go slow. You just, one of the things that we coined at Facing Homelessness was just say hello. Just start. You can, on the way to work, say hello to somebody, and maybe for 10 times it's just hello, and then it's, oh, what's your name? And then it's, hello, Dave. And then, Dave, here's my lunch. I didn't have time for it today. And you might have found your best friend, or maybe not. Maybe nothing will come of it, and that's okay too. But we all get good at what we do. And so if we practice compassion, we get better and better at it. If we practice indifference, or, I'm going to walk around this person, or walk away from this person, or pretend that I'm not seeing them, we get good at that too. and we should be careful about what we do because we'll get better and better at it. So when you start slow and you find yourself suddenly speeding up, you're meeting people, you're actually getting involved. I do think there are a lot of things that we humans need to be mindful of. It was discussed earlier. Erika, I think you were talking about, do we all have mental health? Do we all have mental illness? Where are we on that spectrum? I think for sure, I believe we're all on a spectrum. And there is this issue of being in a home, having means, and seeing someone without means and suddenly needing to be the savior, and I'm going to help this person. And in that, there's a hierarchy that's set up. And I just want to caution against that when you're doing outreach, is that to walk side by side and to not let the hierarchy happen, to realize that when you give, that you are getting as much as they are, maybe even more. Often that's the case. And this is important because when this person moves up and gets legs underneath them, it will change the power dynamic in your relationship if you hadn't started walking side by side. It's difficult when parents see this with teenagers all the time, right? Like when they grow up and they start actually challenging you, if you haven't been treating them equally from the beginning, there is going to be this bizarre power struggle. And I think parents and families struggle with this in our culture because we haven't learned how to see the person fully when they're a kid. We think there's a power thing going on. That's another conversation. But it's mostly checking in, I would say, with yourself and knowing that the person that you meet outside is going through something, even if they don't let you see it, to check in with their biorhythm, to match their biorhythm. You don't need to bring your crap to them. They've got enough. Basically, I think the beauty of it is you'll find it on your own as long as you're correctly seeing this. This is your journey of compassion and love, and in that honesty with someone that's struggling, you're going to grow as much as they will. And that's the human journey. That's what we're doing. There's probably, in my opinion, nothing more important than that. So I know I forgot some things. I'm looking at the clock.
That was really beautiful, Rex. That was really beautiful. Thank you.
I want to share one thing. It has to do with mental health, specifically. The importance of what we do for each other, with mental health, and of course we need mental health professionals, but to remember that, very few of us are mental health professionals, and that doesn't render us useless. We can sit next to somebody, we can absorb and be there for their energy. When we feel really good in our life, our bandwidth for absorbing caustic shit increases, and we can do that for someone that is actually struggling. And what makes that work is when you see that person, when you see their beauty and their deep humanity. And the story I wanted to quickly share is there is a gentleman that is chronically homeless, been homeless for years and years. He's an artist, really beautiful man. And we got to know each other quite well. And there was a time when he was close to my office, my architecture office at the time in Fremont, and where I was getting lots of just people dropping off donations. And so I was on the bike ride home, dropping them off with people. And I came to him this one winter day with this big, heavy parka. And he was on the parking strip yelling across the street at people, just in a really bad state, was losing it. And I didn't know better. It was early on in my own journey of meeting people outside. And so I waited, and what I've learned now is I would have just gone and left because he was in a moment, right? But I didn't know that. And I thought, oh, I'll just say something nice to him to make him feel better or whatever. And so he saw me, he turned around and he saw me and he started charging at me and he said, "What are you doing, sneaking up on me? Why? I know what you're up to." And I said, "Oh, Ben, I'm not up to anything. I'm just bringing this coat for you. It's cold and this is a really warm coat that got dropped off." And he came and he grabbed my bike and he started pulling on it. And I said, "Hey, let go of the bike. I'm leaving. Here's the coat." I threw it on the ground. We were both pulling on my bike. And he let go and he took a swing at me. It's the only time in 12 years that I've had anything remotely close to something being violent. And it just grazed my chin. And I said, "Okay, I'm out of here." And I'm running with my bike and he started kicking the spokes. And now the wheel doesn't turn. And he chased me for half a block. And then he went back. And I got to the corner, my heart's pounding out of my chest. And my first thought was, "Oh, I feel so bad for him." And it's because, it's gonna make me cry. It's because he was a friend. That's it. If he wasn't a friend, I would have called 911 and said, "There's a lunatic here," right? So this is why, in my opinion, we can get overwhelmed with the intellectual discussions about homelessness, and those are important, but we need to do the work of examining ourselves and challenging ourselves and reaching out. Sorry, I didn't expect that, but anyways.
So thank you for letting us into that, though. I mean, you've internalized so much of the heart of the work. I've seen so many people reacting to it. I'm seeing you on video. I know, Rex, you haven't necessarily been able to see everyone's face and see the chat, but I think we're feeling it with you, and I thank you for your time. And I know we're a little bit close to the end, and clearly there's more time to spend on this subject matter. But I do want to leave with a question about how do we stand up for better mental health care? And this is maybe for Erika or Rex or anyone else in the audience. What can we do to help change this? Because, showing up for our neighbors, engaging, just saying hello, those things are critically important. And our state is not doing enough, right? Like we heard from our program support staff at different programs, program managers, they're saying, it's months to get anyone help. What can we do?
Erika probably has more information on this than I do. And now that you've taken your mute off, I'll let you go. Sorry.
I mean, the good news is UW is building a new new psych institute. I think it's going to be over 100 beds. So they're expecting that to open in, I think, 1 or 2 years, because it takes a while to build things. So we're slowly inching there. I think Rex brings up a really good point. I think people are very reluctant to call 911. And when you think about the oddity of calling law enforcement to respond to a mental health crisis, unfortunately, this is not ideal at all, but this is the system that we have. With respect to your friend Rex, it does hurt to see that. One of the ways I think about it is when I do call 911, it's a last resort, but I could be saving them from getting hurt, or I could be saving them from a prison sentence. And that to me is the trade-off. I don't like the system, but it's the best one we have to work with. But the other issue would be to encourage, they used to have a social worker who went out with police. So we could encourage more of that, doubling up social work and mental health with the police, and really basically getting mental health on the front lines of dealing with mental health crises and not law enforcement.
Yeah, indeed.
I think I'll add, I agree totally, Erika. I would add quickly that this conversation on homelessness always embodies this tug of war between top down and bottom up, right? And which is more effective? And I think the answer is you need both. You need people advocating for political change, and you need to not underestimate the power of community. I used to say this very crass example, and I guess I'm just going to again, but I don't usually say it anymore. And that is, we don't allow people to shoot dogs in the middle of the street or on the street or anywhere, right? Because we collectively have all said, that's not acceptable. That's just not acceptable. But we haven't said it's not acceptable to let people sleep under bridges or in the parks. So yes, we need politics to be really answering to these issues, but we also need community to rise up and say, this is not acceptable. We can't let people who are suffering with mental health issues live on the streets homeless, or anybody for that matter living on the streets homeless. It's just not acceptable.
Yeah. We're failing as a community, and we all have a role in that, right? When we're leaving people behind as we are. And that might look like voting, that might look like keeping an eye on advocacy, and that's definitely going to look like showing up with your heart, and being a genuine human with other genuine humans. So to all you other genuine humans, thank you so much for your time. I just, everyone please join me clapping, chats, wherever, waving hands to give a big round of applause and gratitude to tonight's speakers, our resident Mark, our housing services director Teena, our Nair, our program assistant Kate, Erika and Rex, who you just heard from. Thank you so much. And thank you to our audience members. We so appreciate that you made time on a Wednesday night to come and hang out with us and engage in conversation. Clearly, there's more needed. Speaking of that, if you have a friend, family member, peer, coworker who you think would benefit from this programming, or if you want to rewatch it yourself, we are recording the event so that we can share it later. So that will be made available on our website in a few days on the Compass Navigates webpage. And we'll also be sharing it along with our e-news at the end of June. We're also going to send out a survey to poll you on what more you want to hear about, how's this format working for you, all that kinds of stuff. So you'll see that in our e-news. If you have not signed up for our newsletter, go ahead and click on the link that's getting dropped in the chat, and that will take you to a short form to sign up for that. I also just want to say thank you so much to our Mission Advancement Officer, Ann Giannetti. Anne is the engine behind this event. She spent so many hours and so much of her heart aligning these speakers today. And I'm just so grateful to all the work you put in, Anne. Thank you so much. And also to Nathan Jackson, our communications manager, if you could wave. Nathan's been the engine behind your Zoom tonight. So thanks again, everyone. Appreciate you spending the time with us, and we'll see you in a few months for Navigates for Q3. Thanks.